introduce one more speaker who wants to speak 2 minutes, and I want him to speak. He's Paul Wilson, the CEO of Park Center, the comprehensive mental health center for Allen, Adams, and Wells County.
Thank you. I just want to say a couple things that haven't been perhaps touched yet in our speakers thus far. The first thing I want to do may sound sort of shocking, and that is we have plenty enough money in this country already for health care. This is not an issue of needing more money. This is not an issue of needing more taxes. This is an issue of putting together a rational system. We currently do not have a system of health care. We do not have planned activities that interact in a comprehensive way. What we have is a lot of people making money in the healthcare arena, making as much money as they can. Larry Glasscock, the CEO of Anthem, a few years ago got a bonus. This was on top of his regular dollars. He got a bonus of $25 million. That was for 1 year. His bonus basically meant that Anthem was very effective at denying care to people, because insurance companies make money in one of two ways. They either charge too much or they deny care, and then they make a lot of profit. What we need is a single-payer system that takes the insurance companies out of the middle of the deal. In Canada, they have one person doing administrative tasks in healthcare for every 10,000 citizens. In our country, we have 20 people doing administrative tasks for healthcare. We put our money into administrative tasks. The General Accounting Office in Washington, D.C., a nonpartisan, neutral organization, has done a study and indicated that there's plenty enough money in this country to provide good health care to everyone if we went to a single-payer system. Essentially, this means something similar to Medicare for all. Medicare has a 2% or 3% cost structure, depending upon which study you look at. So 2 to 3% of their cost for Medicare go to administering the program. That's similar to a 20% cost structure for private insurance. And overall, our administrative costs in this country are 30%. When those dollars eventually come to providing health care, we can provide great health care for everybody. But here's the deal that you have to think about, and this is where we got to come back to you. Who do you think the prime players how do you think those insurance companies use their dollars? They don't use all those dollars for research. In fact, the pharmaceutical companies don't use all their dollars for research. In fact, the profits that pharmaceutical companies make, a very small percentage goes to research. But they do put an awful lot into lobbying. So the pharmaceutical industry and the insurance companies spend lots of money, and they send that to our legislators. So therefore, our legislators aren't going to mess with the system. They're going to tweak it a little bit. They're going to placate us. They're going to add a few more people each year to make us think they're doing something about it. But this is not going to change because our legislators get enlightened. This is going to change because we all put pressure on people. So I guess what I want to say to you is, if you want this to happen, you're going to have to take some responsibility for it. You're going to have to talk to people. They'll change it because it's a groundswell, not because they want to change it. Just want to let you know. Thank you.